Yeah, Ron Pollock is with us. He is the founding executive director of Families USA. The website, of course, familiesusa.org. And Ron, give our viewers and our listeners an overview of what's going on here.
Well, we have hundreds of people here who are activists from all across the country, and we're talking through what we need to do in the months and year ahead. And the key task at this point, unlike last year when we weren't sure whether the Affordable Care Act would survive, Supreme Court challenge,
Right.
the presidential election,
Yeah.
now we know the Affordable Care Act is going to move forward. And in 11 months, it's going to be implemented. In 8 months, the enrollment period begins so that people who don't have coverage but need coverage can start getting enrolled.
So that's what, September, October?
It starts October 1.
October 1, okay.
And the enrollment, while it starts October 1, applies starting January 1. But it'll take a while for a number of people to get enrolled.
Sure.
So job one that we're all talking about is how do we make sure that the tens of millions of people who don't have coverage, can't afford it, are going to get the help they need, because the Affordable Care Act does provide help, but unfortunately the overwhelming majority of people are unaware of it. So we've got to undertake a major public education campaign so that everybody who can really benefit from it actually learns about it and gets enrolled. That's job one. Now, we got a number of states, as you know, that have not yet chosen to expand their Medicaid programs,
Right.
which is allowed under the Affordable Care Act. And the Affordable Care Act provides very substantial money to the states that choose to do it, 100% of the cost of expanded coverage for the next 3 years.
That's still not a good enough price for Bobby Jindal and Rick Scott.
Yeah, that's right. That's right. I have a feeling that
Free is not a good enough price.
the overwhelming majority of governors ultimately are going to say yes. We already have 4 governors who are Republicans who said yes, and Arizona, New Mexico, Nevada, and North Dakota. I think there's going to be another major announcement next week. I think that as states and governors understand that, first of all, it's not going to cost their state money, and it's actually going to save the state money. Because remember, when somebody's uninsured, goes to a public hospital and gets care, that costs the state money. Well, it's going to save the state
Right.
money.
And that, by the way, is a law that Ronald Reagan put into place in the 80s, is that the ERs had to take people in. Before that, they used to throw people out.
That's right. And of course, this is going to mean more jobs. It's going to strengthen the economy because there's a huge influx of dollars that will come to a state. You know, can you imagine, how does a governor from Louisiana say to his constituents, you're going to be paying federal taxes, and those federal taxes are going to go to provide health coverage for people in California and New York, but you're not going to get it here in Louisiana?
Right.
I don't think, I wouldn't want to try to sell that proposition.
Yeah, Bobby Jindal's going to have a challenge on his hands, and Rick Scott and a lot of these other guys. Respectfully, isn't it the job of the Obama administration to inform people of this rather than independent groups like yours? And maybe you should be doing more like advocacy, or is advocacy and informing people the same thing? As people learn about it, does that get them more excited about it so they're more likely to get politically active to push back against the attacks on the program? Or am I missing your mission statement?
Well, first, let me say, I think the Obama administration is fully committed and will be undertaking a vigorous effort to inform people. Secretary Sebelius, I think, is going to continue to be tireless in going around the country and informing people. So the administration is going to do the job. But this is so big. This is unprecedented. We've never seen such an expansion of coverage. So it really is important for the public and the private sector to do this work. For those of us who've been working literally for decades to try to expand coverage for people that don't have it, well, we won a big victory in 2010 with the Affordable Care Act being passed, but it's only a piece of paper right now.
Yeah.
And we now have to make sure that as the rubber hits the road, people learn about it. So we will be working closely with the Obama administration to make sure people learn about it and actually get enrolled.
Now, there actually are a fair number of pieces of the Affordable Care Act that have already come into law. You know, your kids can be on the program until they're 26. And, well, actually, if you could bring us up to date on what has taken place, what's going to take place, and at what point in time and under what circumstances will the state of Vermont, which has already passed the legislation, been signed by the governor, they got the task force working on it right now for a statewide single-payer healthcare system, when will they be able to kick that into place? Montana, of course, is looking at the same, and you may know of others, Ron. We're talking with Ron Pollock, by the way, who's the founding executive director of Families USA, who's putting on this conference here.
So there are a number of things that already have taken effect. So you mentioned one of them. Young adults up to their 26th birthday can stay on their parents' policy. There are close to 3 million people, young adults, who've gained coverage that way. Children can no longer be denied health care coverage due to a pre-existing condition. And come January, that protection is going to extend to everybody.
Wow.
So that's very important. So many people who need health care the most may have diabetes or asthma or something that's even more life-threatening. They no longer can be denied insurance due to a pre-existing condition. Small businesses are getting tax credit subsidies so that it's affordable to continue providing coverage for their workers. Seniors are receiving benefits. They have this big gap in coverage. They are now getting help with that coverage, and that'll continue. They're now getting free preventive care services. Now the bigger reforms go into effect that enable people to get coverage in a new marketplace and get subsidies for that.
And that starts over the next year or two. And just real quickly, when can Vermont kick in? Is that 2014 or 2016?
I think it's 2016.
Unless they get a waiver from Congress, right?
Yeah. So that's going to be a very important experiment to watch.
Yeah, it absolutely is. I think it could be the Saskatchewan of the United States. Ron Pollock, the founding executive director of Families USA. Thanks, Ron.
Good to be with you, Tom.